Welcome to Red, White, and Blue. I'm Gary Polland from the right.
And I'm Dallas Jones from the left.
This week we come to you in a kind of a unique time, at least in my lifetime. We're dealing with the coronavirus, and we're dealing with the ramifications of that. And to discuss it in a very calm and measured way, we have two really bright people to add to your understanding of what we're dealing with. First, Congresswoman Sylvia Garcia. Sylvia is almost like a guest host on the show because she's been on so many times, but welcome.
Thank you for having me again.
It's always a pleasure. And we're also blessed to have Dr. Shital Patel, who is the Associate Professor of Infectious Diseases, which is what we're dealing with at Baylor College of Medicine, and I'm told one of the world-renowned experts in this area. So I'm sure you have a lot of answers for us, and we're glad you came.
Thank you for inviting me.
Gary, she's going to correct all of us.
I'm sure we have a lot to learn.
She's the expert.
Well, good. So first of all, welcome to both of you.
Thank you.
You know, both Gary and I have talked and believe that this particular show is so important, given what is happening around our globe, but particularly here for people in our region. We have an obligation to really provide meaningful information that we hope will calm a lot of the anxieties and the fears of people in our region. And so, you know, I will actually direct the first question to you, Dr. Patel. You know, in a very, I guess, layman's but realistic way, if you could explain to our viewers, what is it specifically that we're dealing with, and why is it that it is causing so many different actions that many of us have never seen in our lifetime?
Yeah, no, that's a very good question. So what we're dealing with is a virus that the human population has not ever experienced. It's distinctly different from some of the other coronaviruses that cause common cold. And given that, then our body doesn't have that protection to combat the infection. And that's the majority of the population. So we have, 7 billion people in the world? And so we don't know a lot of the answers. So what will this virus do? We do have some answers from some of the experience from China and from now Europe and Italy, countries within Europe, Italy and Spain and France and UK. We know that this virus can cause rapid infection and outbreak within a city, a town, a country. It has 80% of people may have mild to moderate symptoms, but then the other 20% of people, some are in the severe category, some are in critical category where mortality is occurring. Fatality rates are in about 2 to 3%. Majority of people in that category are those individuals that are over the age of 60, those individuals that have chronic medical conditions like high blood pressure, cardiovascular disease, lung disease. Those have immune suppressive conditions, so people who have had stem cell transplant, bone marrow transplant, organ transplant. And we don't know what the mortality or complications to pregnant women is yet. And a lot of it is new. We just don't know all the answers of a new virus coming into our population, and how are we going to deal with it?
I want to ask you, by the way, Sylvia, the at-risk group includes you and me, dear, just in case you were wondering. But I wanted to ask you, when did this...
And me, I'm a diabetic.
Okay.
And many of us have
Well,
conditions.
and that's what's surprising about this virus is that most people think it's just the elderly,
right.
but they don't think themselves of being in that group. But
Even
it's
though we
more
are.
than just the elderly, as she has described. So I think we all have to do a better job of taking care of ourselves, and you know, we got to remain calm.
But I want to ask you.
We've got to wash our hands.
Absolutely.
We've got to stay home. You know, in any emergency, you know, we always hear Judge Hidalgo and Mayor Turner tell us, you know, don't go out in the rain, don't go out in the storm, you know, stay in, go out only if you have to. It's the same kind of thinking. This is just a very different kind of storm.
But I wanted to ask,
we shouldn't get out unless we have to. And the have-tos are for medicines, for groceries, for a job, or first responders that need to get out.
Or for Red, White, and Blue, right?
Well, or to come here to be with you both.
But I wanted to ask you this, Sylvia. You've been...
We got to be careful.
Absolutely. You have a lot of experience. I mean, you have a long and distinguished career in terms of public service. You've done a lot of different things, but that gives you a very interesting perspective, right? I mean, I think you're probably much more sophisticated, have much more experience than the average freshman congresswoman that you are when you came to Washington. And I think that was reflected in some of the responsibilities you've had. But what I wanted to ask you was this: when did this get on your wavelength? You know, when did somebody tell you, hey, this coronavirus 19 out of China is a potential problem for the United States? Is it in the last month, like it seems like everyone else discovered it?
No, it's, to me, I think we started hearing some reports, I think it was like about mid-January, and, you know, we saw it in the distance because it was coming from China. We saw it, you know, we see it in the news, it's in other parts, but now it's here, and it's real, and it's impacting so many of us. Whether or not we get the symptoms, whether or not we get tested, it's impacting us all. It's a domino effect. I mean, you know, my brother's already been told he may get laid off because he works for
the economic impact
an oil
is
and gas
significant,
company, less demand on work. My sister was denied services for home health aid because they don't want to take new patients unless they've been tested. My nephew was told that he works for a small company. You know, they don't have paid leave. They don't have some of the benefits to give him. So he started delivering for favor last week because he's got to make ends meet. So we're going to have a lot of people who will not have jobs, people who are going to need food on the table, kids at home who need their school lunch program at home, need their breakfast programs at home. So we have a lot of responsibility as a government to take care of people. That's why the first round of bills that we put out there were to work on the research, to work on the vaccine, to work on the things that, on the healthcare wise, but this last week it was about making sure that tests are free and available to everyone, that we have the food programs for our seniors and our children and our veterans, and that we can take care of people in nursing homes, that we can get food to people. I mean, there's just so many human needs that we've got to take care of because people are going to lose their jobs.
Yeah.
So,
and I'll just add, along with all those items, the other things that are in the background. So having enough tests, but then having enough personnel to do the tests, having the reagents, having the pipettes, having the solutions in the lab, the protective
so you
gear.
Can get the results.
So and the flow of getting the results, right? And the protective equipment is so important because we can't do a test if we don't have the protective equipment that the healthcare workers need to have.
Is it fair to say, Dr. Patel, that this, and hopefully the virus won't turn out not to be as bad, at least medically, for American people as it could be, but then have we ended up learning a lot of things that we need to be doing to prepare? Because this is not like these viruses, they show up every year. Right. Some are worse than others, and obviously one of the things I think we all learned here, being dependent on China for a substantial part of our pharmaceutical drugs is not a good idea.
I think this is going to be a big learning experience at every level, at economic levels, even at small business level, and then in the healthcare sector too, that how much investment do we can never predict the next pandemic. And we were talking earlier about the 2009 H1N1 pandemic and the work that went in after that pandemic, pandemic preparedness. So many of the institutions, many of the federal CDC, NIH had plans in place for pandemic preparedness and discussions about surge capacity. But a pandemic never kind of came. And so keeping people in those discussions is important. And we learn as much from this and help mitigate it. I mean, our goal is to mitigate and not see what we're seeing in the other countries here in the U.S. So that is why social distancing, we want to flatten the curve and we want to make sure we keep our citizens safe, but we also want to not overwhelm the healthcare system.
There's a lot to cover around this and a lot of information to give. And so I'm going to do something I haven't quite done before, but I'm going to give just a couple of quick rapid questions that I think people need to know the answer to. And I think both of you can probably speak to some of these. And then if you care to elaborate after that, please do so. Do we have enough tests?
No.
No.
How long will it take us to get to, do you think it will take to get to a level where we actually do have enough tests?
My understanding is that we're at least 2 weeks behind.
Yeah.
There's still not enough tests in Houston, Harris County to really test everyone that's even sick. Some
But then
people
we
are
also have the other issue with who's going to
The staffing level,
staff
right.
from staffing.
Right.
And I'm going somewhere with this. Dr.
Yeah,
Patel.
so agree that if the pace is coming and if we believe that tests are coming 2 to 3 weeks, we will have enough tests.
Now, in that 2 to 3 weeks, will we see I don't want to say astronomical, but a large number of increase because we have more tests of cases?
I would say that's a double answer. I would say if we do a good job with social distancing, we're hoping we're not going to see that ramp up.
Okay.
But definitely if we have more tests and we're able to test more people, that number will go up.
If you look at the numbers of where we were when Texas first started keeping track, it seems like it's doubling every week. Like the numbers went up over the weekend. I mean, we've had our first death in Matagorda County. So I think
In the state. First
in the
death
state,
in the state.
state, correct.
Okay.
So I think it's important to remember that, the tests are behind 2 weeks, so we may still see increases 2 weeks until we really get the tests and everything that we need here in the Houston area. And until we do that, it may get worse than we think in the next couple of weeks.
So to bring it full circle, and why I'm asking these questions, we're going to see this. And Gary and I had a conversation prior to taping that, and I don't know how you feel about this, but we believe that a lot of the panic and hysteria around what is happening is what's actually fueling some of the economic, most of the economic concerns and things of that nature. And so I ask the questions because I want people to understand that you're going to see an increase, but that doesn't necessarily mean that we're any less safe. And that's kind of what I'm hoping you all can speak to in general. I mean,
Well, I think I'm going to have to disagree with you in part. Okay. Yes, it's true that because you get more tests, you can test more people. It's like, rate was, we heard about more rates because more people reported it. It's kind of the same thing, right? But the challenge is that if people don't listen and don't wash their hands, don't wash them for 20 seconds,
right.
Don't stay home, don't really practice what we're trying to tell them to do is just to stay home and not come out unless you really have to. And it's only for groceries, it's only to get medicine, it's only to go to your job or you're a first responder, then it will spread. And it won't matter how many tests we get because we're not going to be able to keep up. But we don't want people to panic now. We want them to remain calm and listen and take care of themselves and those in their household.
Thank you.
Dr. Patel, we have taken the precautions have been made. I mean, obviously there's been lots of news over the last month accelerating every day to the point where I actually believe we're in a panic, at least in the economy. Is this enough to fit with what Congresswoman Garcia said? The people are going to take it seriously and start doing the things they need to do so we can reach the peak level of infection and then it starts declining because of precautions.
I think, there is a lot of anxiety and a lot of panic. People are doing some of the things that we need to do. Is it as strict? Are people being as strict with their social distancing as maybe it needs to be? Maybe not. And maybe now with restaurants and bars having to do to-go services and delivery service, that will help that. But we were talking about tier testing and how right now, because we don't have enough tests, there's tier testing. So those that have certain symptoms and significant symptoms, they're in the hospital, need to go to the hospital, they're kind of first priority in getting tested. And once we have more tests, we'll be able to test more individuals and we'll be able to counsel them more about you definitely need, we're telling people if you have symptoms, you should self-quarantine yourself. We don't have a test to test you, stay at home. We don't know if you have the flu, we don't know if you have coronavirus, but self-isolate. But when we have more tests and we're able to test more people, maybe that will help even push that message further.
Now, in terms of what's been going on in Washington, have you found, to be fair, and you would agree with me, we probably reached the height of partisanship during the impeachment process. The Republicans and Democrats, they couldn't agree the sun was shining. Now we have a crisis. It doesn't discriminate between Republicans or Democrats. It's all about people, right? It's all about people. So has there been a decline in the partisanship so there's an interest in working together to try to alleviate the economic problems that you so aptly described earlier?
The bill that we just voted on in the wee hours this Saturday that was about taking care of people, the tests will be free to anybody who needs them. The food security programs that we funded, the income security programs, enhancing unemployment, making sure people have at least 2 weeks of paid leave. All those things are important. And there was only 40 plus, I think it was 43 Republicans who voted against it. I mean, the president wanted it passed. He tweeted.
So it was bipartisan. Bill.
So it was a bipartisan bill. Unless it happened within the last hour, the Senate still had not passed it. Probably by the time the viewers see this program on Friday, they would have.
Hopefully they will.
And hopefully then we'll have a proposal for round 3, which will be to provide financial assistance to every adult in a household and the children to make sure that they have the money to meet their needs, whether it's utility assistance, rental assistance for mortgages, for car notes, to make sure that they have money because we know people are losing jobs. The number that it's being thrown out is $1,000 per adult and $500 per child. The Senate is working on a proposal. I'm not sure yet exactly what they're going to zero in on.
They're also going to set
but they're also going
tax
to,
day, so you don't
right,
have to pay your taxes.
and they're also going to look at bailouts for the airline industry and a lot of the sectors that are being impacted. So, what Mnuchin said earlier today was that it would be a $1 trillion bill. That is huge, huge. And we're going to have to look at it because I know that I would prefer a massive infrastructure bill. We've been talking about that ever since I got to Congress.
I remember.
And that creates jobs, that stimulates the economy. So I think we're going to have to look at a number of policies, financial assistance, the food security, help for businesses, and I don't mean just the big corporations that are concerned about their oil and gas subsidies. I mean making sure that our small businesses or mid-sized businesses, all these restaurants that are closed, will they reopen? Will they have the workers? So it's a domino effect, and we're going to have to look at it. We passed one package already. We've already voted on the second one. We're looking at a third. And we have to do a fourth. We have to do a fourth because, again, this government should stop at nothing to make sure that we can take care of our people in this emergency.
It's the goal also to, once we get out of this, to get the economy moving in, because the economy was doing pretty good. I mean, not perfect, but it was doing pretty good.
And all these programs will have to have an exit strategy.
Right.
We have to make sure that we say it's for 3 months or for 4 months or after we know that this has subsided, because it cannot continue forever, because otherwise we'll just end up in bukus and bukus of debt that we'll never be able to pay for.
And that was my question. I mean, what is the length of these programs? And then, I have a specific concern about, I think you mentioned it, those small businesses. Do these packages include places like houses of worship and nonprofits, right? Which, this type, a weekly gathering at a church is way over 50 people, and they're going to lose.
I would add nonprofits who right now cannot have their donation drives, their galas
most events are canceled. All festivals, parades, and
the symphony season.
In Dallas, I was asked that. I had a round table with pastors, and I said, look, I know early on, we need to make sure there is a payroll tax cut. That's not just for business payrolls, but for nonprofit payrolls.
Right.
For people, for faith group payrolls.
Right.
It has to be across the board, because in this emergency, again, this virus knows no boundaries.
Right.
It does not discriminate. It's touching every sector. It's touching every part of humanity in our country. So we've got to make sure that it's fair to everybody, and that we do something that will lift everybody. We may not be able to put them back to exactly the way they were, but it's got to be as close as we can. So this government, again, should not stop until we're able to do that.
Okay.
No, I like it. So
You're
cooperation. Well, no, I like that there's cooperation.
No, there
in
is
Washington.
cooperation. I think the big question
Keep
would
the
be like,
focus on the
it's like,
issues and
who
not on the
gets the bailout,
politics.
why they get it, when does it start, how much will it be, and what's the exit strategy?
You mean as opposed to political advantage?
and I think that's the
trying to do
question
that.
that
There's
a
no
lot of
Well,
place
people
for it.
in a lot of rhetoric, we can't have one side of the aisle call the financial assistance to a person welfare,
Right.
or then us or the other side of the aisle going back and saying, well, if you're going to
You're
help,
anti-children.
or well, you want to give help to the airline industry. Well, why are you just helping corporations? They should have done better. We've got to, we can't focus on that. We got to put all that behind us and move forward, because this is truly a national emergency, and we need to all work together to get past it, and to make sure that the trials that they're working on, and they get the dollars for research to find the drug, find the vaccine, find the pill, whatever it is, to get a handle on this virus.
So, Dr. Patel, are we going to get through this for the most part?
Are we going to get through this?
Yeah, at the end of the day, if there'll be a tomorrow.
At the end of the day, we're going to get through this. China has gotten through it to a point, and other countries will get through it. It's how we're going to come out of it is the question that's the unknown. And all of these things that, the pandemic is hitting every sector of humanity, right? Every program, to an individual level. And are we going to come out of it better at some point? And how long will that take?
Take it
it's
seriously,
unknown. Take it seriously now, because we do want to come out of it in good standing.
And that's great, because what I heard you say is we're going to make it through, and I think there's hope that we make it through, in a way that people are able to rebuild their lives. And I think we will.
Relatively quickly.
And I think we will, because one thing about our country is in times like this, we do rally together. Real quick before we go, we only have probably about 2.5 minutes, 3 minutes. 3 minutes, actually. Thank you, producer in my ear. The politics of it all. We saw several primaries canceled today. This is literally, when you talk about disruption of everything from our economy to every aspect of our life, now it's affecting our democracy. How do you see that playing out, Congresswoman Garcia, in terms of the fact that we've had to cancel some primaries? What does it mean for conventions? Here in Texas, there's a call for an all-mail ballot, meaning we can only vote by mail, which would be unprecedented in terms of our runoff that's to happen on May 26th. How do you see all that playing out?
Well, it seems like every day is a different challenge with this virus, not only in terms of the medical research, but the dynamics, everything that's going on. I really think we do need to work with all the states to make sure that they will allow mail ballots, period, for any reason rather than criteria, because not all our states do that. We also need to make sure that we protect the integrity of the ballots and the machines, and that we figure out a way to do voting by even through the internet. I know right now we probably don't have the infrastructure for that, but we need to start working on it, because if it's not this pandemic, it may be the next one where we won't even be able to vote by mail. So we need to start thinking ahead and learning from this event. But it will change the canvassing door to door. It's going to change the rallies. It's going to change the way we do our retail politics. It's going to change not just for us in the campaign arena, but for everyone. I mean, what happens to parades? What happens to festivals? What happens to the galas for Herman Hospital or any of our systems? It's I think we're going to have to rethink all those things. One of the challenges we have is we have to go back to vote for round 3. Will we be able to fly and get there?
Yeah, you're not allowed to vote remotely, are you?
No, we're not allowed now. But even if we were to change that, we got to show up to vote to change that.
Right.
So we're going to have at least one more trip back to D.C. to vote for the third package, and of course to change rules if we decide to do that. It's not been decided.
Well,
but here's the real hiccup. Once we get there, we have to comply with all those rules. So we won't all be on the floor, 435 of us to vote. The senators won't be 100 on the floor to vote. We're going to have to go in groups. So there won't be 10-minute votes. It'll probably be a 4-hour vote. So everything is changing, and we're just going to have to find a way to adapt. But again, we've got to remain calm. And we've got to take care of ourselves, and it does begin with washing your hands.
So that's
for 20 seconds.
Yes, and there's reason for optimism, and I think that's what we got from you
and that's
too.
what we
so
got
that's
from
good.
You. Thank you for both of you
thank
for
you.
being here and your work that you're doing, and we want to let you get back to it. But this has been another edition of Red, White, and Blue. We'll see you next week.